Where is Mordechai? From physician, spouse and mom to a target. By Raquel K. Oh no, March 17, 2022. This is a work of fiction. Names, characters, places and incidents either are products of the author's imagination or are used fictitiously. Any resemblance to actual events or locales or persons, living or dead, is entirely coincidental. My name is Esther Sun. My closest friends and family call me Sunny. I am a physician and a mom. Of the two, being the lucky mom of 3 young children is the most important role of my life. It is also why my journey is so difficult to tell and why I am so scared, but I digress. I am originally from Hangzhou, China, a city not far from Shanghai. I am what people in the medical field refer to as a foreign medical graduate, FMG, because I received my medical education abroad in my home country. After working in my home country as a physician for a few years, I became curious and decided to explore opportunities abroad, eventually immigrating to the United States when I was 27 years old. My future husband, whom I would later meet in the US, would later call me a true pioneer, since I was the first of my family to venture out of the country, having no other family and or support here. I had to count on myself. I came to the United States with a real immigrant spirit. I wanted to make a life here. I was willing to work and study hard and do whatever was necessary to support my new family. With limited English and not having studied medicine in English, I quickly enrolled in a medical terminology class at a local adult night school. I also practiced English with my husband and his family and watched a lot of television, including a lot of medical dramas, to get up to speed. From there, I studied for my medical boards, took, and passed the exams, and landed a great opportunity in an internal medicine residency in Manhattan. After graduating from residency, I received a hospitalist teaching position at a major Chicago hospital. My husband and I settled in Chicago, with me working as a hospitalist for a couple of years until I opted to move to a clinic setting, working as a primary care physician at the top HMO in the Chicago area. After working in Metro Chicago for 12+ years, I became curious about different physician opportunities, those in a non-HMO clinic setting, especially university-based where teaching would be part of the experience. Ideally, I wanted to be part of a practice connected to a world-renowned medical school, where I would not only practice medicine, but also teach and have a chance to make a positive contribution to the future of medicine. I was ready for change and a new journey. Then out of nowhere, I received a recruitment letter at my home, from City of Angels Medical University, CAMU, in late spring of 2018. Honestly, I was surprised. Being an FMG, it is extremely difficult to get the attention of the top university medical programs in California, who tend to prefer US-educated physicians and have historically included the reference US-trained preferred in their classifieds. Nevertheless, I was excited at the opportunity. The chance to work at CAMU seemed to be the perfect fit. After all, it was ranked in the top 10 nationwide, and it was in Los Angeles, which would be close to my in-laws and my young children's grandparents. At the time, I also happened to be in a serious conversation with an Ivy League-affiliated program in New England regarding a position with them. As you can imagine, I was on cloud 9, brimming with joy at what the future would hold for me and my family. For the next couple of months, I was going back and forth between CAMU and the school back east. By summer I had interviewed with both and had received an offer from the latter. After traveling to Los Angeles interviewing with the management team there, I received an email from CAMU that I needed to set up a phone interview with Dr. Harry Mann, the Executive Vice Chancellor of Medical Services. During the call with Dr. Mann, he came across as warm and charming. He asked about my children, husband, older brother, and parents. Feeling at ease, I was quite open to Dr. Mann and told him about my family, including the fact that I was the first to immigrate to the US, that my parents were older and retired and that my brother was a surgeon in South Carolina. I also indicated that my husband would need to find a new position if we were to make the move. I told him that I was my family's main provider and that I had no safety net. Shortly after that conversation I received an offer of employment from CAMU Health and the CAMU James Sheep School of Medicine, for a position at the clinical instructor level. Believing that the title was too entry-level, given my years of experience, I initially turned the offer down and notified Dr. Harman that I would instead be taking another position. It was then that Dr. Harman reached out to me. He politely asked me to hold off on signing the offer from the other medical school. He also indicated that he thought he could convince the executive chairman, Dr. Ahashvi Rosh, and the academic senate to raise the title to assistant clinical professor based on my prior teaching experience. Feeling impressed by his personal outreach and indebted to his effort, I told him I would hold off and wait for him to get back to me. He eventually got back to me with a new offer under one condition. I had to submit several clinical vignettes for the CAMU Proceedings, an in-house journal that he edited. The articles were to be based on unique cases I had experienced in my current position. The first major hurdle was for me to complete the series of clinical vignettes and get them submitted quickly. I was told these vignettes together with my CV, letters of recommendations, and past student evaluations were needed to justify the request to have me start at CAMU with the title of Assistant Clinical Professor. Subsequently, Dr. Mann then sent me a link to my smartphone which would then provide me instructions on how to format and submit the vignettes. He would later make an offhanded remark to me about how quick I was to hit that link. To this day, I am not sure how he knew and what it implied. I did rush to get everything submitted and soon after I received a formal offer letter in the mail. I signed it and was asked to start on January 1st instead of January 7th, 2019. The second major hurdle was to secure a rental apartment. However, being in Chicago and with my young children in school, it became logistically impossible to get to Los Angeles to find a place to stay. Later, realizing I did not have housing, Dr. Mann then graciously went out of his way to help me to navigate the CAMU faculty housing and help me to secure housing. The only drawback being that the unit was a university-owned condo in a luxury building on Main Street commanding a rent that exceeded $5,000 per month. With my husband not having a job in Los Angeles and the fact that I had 3 kids to support, the rent was steep. On one hand, I was grateful and further indebted to Dr. Mann, and yet on the other hand I knew the opportunity to work at CAMU would come at a huge cost and financial strain. By late fall, the offer was signed, the credentialing was completed, and the housing was settled. Thinking everything was set, I was notified about 6 weeks before I was to start, that additional onboarding needed to be done in person in Los Angeles between Christmas and New Year. This meant that I either rented the luxury unit 1 month prior to my start date, pay at least $5,000 for the month of December, or stay in a hotel during the expensive holiday season. It was also at this time that I was misinformed that the CAMU housing office would be closed until after January 1st. This meant that I could not pick up the keys to my apartment and move in until after I started working. It also required me to stay in a hotel until after New Year's. Logistically, it became a nightmare. It was later that I learned that the CAMU housing office has someone working 24/7 365 and that a key could have been arranged for pickup anytime. Further adding to the financial stress, was the clinic location I was assigned to at CAMU, and the significance of it. While I knew that I would be working at the CAMU Vashti Women's Health Clinic, and that there was 2 near identical units, adjacent to each other, and providing identical services, I was not aware of the difference as far as fees levied to patients that would ultimately impact my income potential. By working in a female-only clinic, I was now not only limited to serving a single gender, but also the unit I was assigned, Unit 1313, charged an additional facility fee that most PPO insurance companies do not cover. On the other hand, the adjacent unit, 1777, provided identical services but has no facility fee. It doesn't take a math whiz to figure out which unit a patient would prefer, the non-fee clinic of course. Bottom line, as a new physician, with no patient base, limited flow of new patients, living in a luxury building supporting my husband and 3 kids, I suddenly found myself financially in a hole and in need. On top of everything, because I felt indebted to Dr. Harman's initial gestures, I voluntarily took on additional teaching responsibilities beyond what was required, which at times took me out of the clinic. After all, Dr. Mann was responsible for finding preceptors to teach medical students, and he always gave the impression that it was hard to recruit physicians to teach. I felt he deserved better, and I wanted to help him. As it became clear to me that working at CAMU was not financially viable, I started looking for other opportunities and engaged the Ivy League school again in New England. I also met with Dr. Mann and told him of my financial dilemma, asking him if I could be moved to the non-fee general internal medicine clinic, which serves both genders. It was here that he arranged for me to work a few extra hours in urgent care along with additional clinic time after hours in a non-fee clinic. In the meantime, I had a video interview with the school back east, and they made me another offer. While I was thinking the offer over, suddenly a position in the non-fee clinic became available. At this point, I was notified by email that my main clinic location would be moved out of the Vashti WHC fee-based clinic to the General Internal Medicine Clinic. In that email, Dr. Mann indicated that he wanted to discuss the situation in person and offered to stop by my office. Later, he came by my office. After sitting there in silence for a moment and stroking his mustache, Dr. Mann became visibly irritated. He finally spoke up, but it had nothing to do with my move as far as I could see. He just said that he was the lowest paid in management and that if he is paid more, it would mean less for the other physicians. Not knowing what to say to him, and after a period of silence, he just got up and left without saying anything more. Later that evening, I called my husband, who was visiting his parents, and told him what happened. I asked him the question that is probably on your mind, and he said, "No way, impossible." Leaving it at that and feeling perplexed, I did the only thing I knew how to do. I dug right into my new job with gusto. I was super motivated and eager to work hard, and I kept my productivity up. Still feeling grateful to Dr. Mann for the opportunity to excel at CAMU, I took on even more teaching just as a thank you for what he did for me. After all, it was the opportunity one needed to survive. It was a lifeline that came just at the right time. I was hooked. As you can imagine, I was just ecstatic. Thinking I owed Dr. Mann so much, I thought the best way to show my appreciation was to work hard and to not let him down. Please understand that by this time, I was starting to get conflicted. On one end, I was pleased with the move to the new clinic, but after everything I had gone through plus that strange meeting I had with him, I started to get homesick. I missed my elderly parents who were living in New England alone. On the other hand, there was the issue that Dr. Mann was planning on retiring at the end of the academic school year, the end of June of 2021. Given everything, especially with him moving me to the very best primary care clinic on campus, there was no way I would leave him in a pinch. Therefore, for the second time, I turned down the other school's offer of employment, telling them that I would reach out to them after Dr. Harman's retirement. Again, I was happy and grateful for the new clinic location, but soon enough, things began to get very dark for me after that meeting with Dr. Mann in my office. I began to get a very strange and uncomfortable vibe. It was as though working hard, teaching more, was not what was being asked of me nor appreciated. From that time forward, things changed. My existing patients from my previous location at the Vashti WHC were not informed about my new office location. I had patients booked in both locations at the same time. I had no formal workspace or office. I was just instructed by Dr. Mann's administrative team, Kathy Kirk and Andy Nolf, that I was to use whatever exam rooms were available, as an office. Therefore, together with a scribe, I had to complete my notes, review patient test results, and do follow-up email in a very small exam room during the peak of COVID. With that said, once in the General Internal Medicine Clinic, my practice thrived and expanded rapidly, which was great at first but soon became unmanageable. I was working until 2 a.m. to 3 a.m. every night and on weekends. Logistically, it became unsustainable. However, when I went to Dr. Mann to have my panel closed for new patients, I was turned down, without any explanation. The situation finally got to the point that I decided that it was best to leave CAMU once and for all, so I accepted an offer as a medical director at APAC Medical Services, a community health clinic, servicing mostly Asian Americans and new immigrants. Even with everything and in hindsight quite dense, I still wanted to express my gratitude and appreciation to Dr. Harman. Therefore, I naively gave a 4-month notice back in February 2021 effective July 2021, to ensure that Dr. Mann had ample time to find a replacement and help to transition my patients. Little did I know that from that point on, my life would become a living hell, and it hasn't stopped since I left CAMU. I hope I have piqued your interest with this introduction, because there is a lot more story to tell. By telling this story, I too need Mordechai.